Picture this. A patient walks into a clinic for the very first time. They're vulnerable, they're frightened, and let's be honest, they're probably in pain. But before they even set foot in a consultation room to see a doctor, they've already interacted with a security guard at the entrance, a receptionist at the front desk, housekeeping staff in the hallway, and a triage nurse. So here is a question for you. When do you think that patient's experience actually begins? It's a super common misconception that care starts the exact moment the doctor walks in. But the reality? A patient's perception of quality care, their trust, and their comfort, that all starts long, long before the clinical consultation. So here's our roadmap for this explainer. First, we'll cover why first impressions matter. Then, we'll map out the patient journey and dive into verbal and nonverbal communication. After that, we'll break down the AIDET communication framework. And finally, look at how every single staff member shapes quality. Section 1. Why first impressions matter. Healthcare encounters don't usually happen on a normal day. They happen during highly vulnerable moments where the stakes are incredibly high. And there's this brilliant concept inspired by Maya Angelou that really hits the nail on the head. It goes, people may forget what was said, but they rarely forget how they were made to feel. In healthcare, a good first impression isn't just about being polite. It's an absolutely critical pillar of patient-centered care. And the neuroscience behind this? It's absolutely fascinating. 7 seconds. That's literally all it takes. A patient's amygdala, which is the brain's emotional processor, activates within milliseconds of seeing a new face, and it subconsciously decides right then and there if it's friendly or threatening. So in just 7 to 30 seconds, your patient has already built this mental framework, and every single later interaction is going to be filtered right through it. And when you manage to secure trust in those crucial opening seconds, well, everything changes. Patients who feel safe are far more likely to share vital information openly, ask the right questions, actually follow your medical advice, and return for follow-up care. So a positive first impression quite literally improves health outcomes. All right, Section 2, the patient journey. To really wrap our heads around this, we have to look at the facility strictly through the patient's eyes. At minute 0, they're getting directions from security. By minute 5, they're navigating registration. Then comes the waiting area at minute 15, and getting vitals checked at minute 25. All of this happens before the doctor finally walks in at minute 30. Every single one of these touch points acts as a building block, and they either strengthen or weaken the patient's confidence in the care they're about to receive. Section 3. Verbal and nonverbal communication. Now let's zoom in on some of these micro behaviors. Just imagine walking up to a front desk. In scenario A, you're met with a warm smile and steady eye contact. Instantly, you feel a sense of psychological safety. But in scenario B, a staff member is just staring at a computer screen with absolutely no acknowledgement that you're even there. That distracted, kind of hurried demeanor immediately breeds uncertainty. It makes the patient feel undervalued before the appointment even begins. And this goes so deep into body language, studies actually show that sitting at eye level with an open posture makes a massive difference compared to standing over a patient with crossed arms. In fact, research tells us that physicians, and this is particularly true for male doctors, are perceived as significantly more competent and empathetic when they just adopt an open, patient-facing posture. Your body literally speaks volumes before you even say a word. But hey, when you do speak, those words matter just as much. Pairing positive body language with a really clear, jargon-free verbal introduction works wonders. Just a simple, "Good morning, Mrs. Sharma, I'm Dr. Rao. It's nice to meet you." Treating the patient as a unique individual instead of just another slot on the schedule instantly reduces their anxiety and builds rapid rapport. Moving on to Section 4, the AIDET communication framework. So to actually standardize this warmth and professionalism, top healthcare organizations use what's called the AIDET framework. It's 5 super practical steps. Acknowledge the patient by greeting them warmly. Introduce yourself and your specific role. Give a realistic duration for wait times. And actually, here's a great pro tip for you. Overestimate that wait time by about 25% just to manage expectations. Then provide an explanation of what's going to happen to reduce any uncertainty. And finally, say thank you for their patience and their trust. It is such a simple checklist, but it really transforms routine encounters into exceptional experiences. Section 5. Every staff member shapes quality.
Now, zooming out a bit, creating a true culture of welcome relies on a totally interconnected web of healthcare workers. I mean, look at all these roles. Patients rarely separate clinical care from the service experience. To them, it's all one big package. So the security guard, the receptionist, the housekeeping staff, the nurse, the lab tech, the pharmacist, and the doctor, they are all equally responsible for building the hospital's reputation. Quality really is a collective effort.
Because when every single employee, totally regardless of their job title, models respectful behavior, it sends this unified, incredibly powerful message to the patient. It essentially tells them, you matter and we are here to care for you. And that feeling of safety and compassion, that is the ultimate foundation of any successful healthcare facility.
At the end of the day, patients might not remember every single medical detail of their consultation, but they will always remember how they were made to feel. The first 30 seconds are not just about making a polite impression, they're really about building trust, reducing anxiety, and delivering truly patient-centered care. Every interaction matters, every staff member matters, every first impression matters. This has been Quality Pulse, where we explore the ideas, the people, and the stories shaping the future of healthcare quality. Thanks so much for listening to this explainer. So I want to leave you with this final thought. The next time you walk into your clinic or hospital, what story will your first 30 seconds tell?